Welcome everyone. My name is Hunter Carithers and I am here from Advent Health. We're going to go over one of our values known as goodness and how that relates to our company. Today we are going to be talking about what goodness actually is, the importance of goodness, not only for society and our company, but individuals as well. We're going to go over some goodness initiatives we do here at the company, as well as wrapping up the conversation with our Advent Health Foundation and what they do. So what is goodness? Goodness is when an individual or group accomplishes tasks for the benefits of others. Goodness is essential for retaining our humanity and increasing progress in civilization. Since we are a company founded on biblical values, I would like to impart the verse, "Do not be overcome by evil, but overcome evil with good," from Romans 12:21 on you all. So why is goodness important? Since we are a business, goodness allows us to have increased relationships with the public from building up trust. Goodness shows that we care and have pride in our healthcare industry. If individuals do not trust us, they will not come to us, especially since healthcare can have procedures that change lives. Not only is goodness important from a business perspective, but it allows a better world to be built. The power of goodness extends beyond relationships by shaping how people see organizations and the world around them. Goodness is needed for people to want to work together to develop new solutions to existing problems. Besides being important for society and our business, goodness also affects the individual performing good acts. When a person does something good, oxytocin is released from the brain, which lowers stress, increases immune system strength, and makes you happier. Oxytocin also promotes a feeling of connection between individuals. By embracing goodness as a guiding principle, you and the others around you can create a positive change, creating a tighter-knit community with a focus on promoting the well-being of each other. Goodness is also contagious. People see good and they want to do good. Rolling into our goodness initiatives, one study we have conducted relates to pressure injuries. Pressure injuries form during surgeries or other extended periods of laying down. Since the body is resting on certain points without moving, the tissues get bruised and cause extra pain to patients. One commonly known form of pressure injuries is known as bed sores. Our study found that the use of a newer technology, known as an overlay, lowers the chance of a pressure injury significantly. After implementing and utilizing overlays, which basically shifts the point where the body is resting on, we found that only 2 out of the 1,111 patients suffered pressure injuries. After doing a review of the 2 pressure injuries, it was found that the pressure injuries resulted from not turning on the overlays correctly. This oversight of the overlays was found to be from the models of the different overlays were turned on differently. So we talked to the manufacturer and they ended up making them all the same way. This case study shows our efforts to make sure individuals don't have to go through any more pain than is needed for their care. Another study we did was on dispensing cabinet overrides. Normally, dispensing cabinets are used as more of a last resort for medications used in emergencies. Dispensing cabinets are heavily regulated and under strict observance because of the medications in them. Normally, medications are stored in a secure facility, guarded usually by pharmacists to administer the drugs. But since dispensing cabinets, are needed around the hospital just in case, they're easier to access. After reviewing the practices at our facilities, we noticed there was an abnormal amount of use at one of our hospitals, which we learned was due to not ordering enough of the medication that was being used because the process wasn't easy. We simplified the ordering process for the medication, which lowered the amount of uses significantly, and implemented continual reviews of the cabinet's use and inventory to enhance security measures. The last initiative that I would like to discuss was that we were selected as the central depot for Florida during the COVID-19 vaccine rollout. We were able to do mass vaccinations for the employees and residents of the state by developing plans, practicing those plans, and then revamping the plans to deal with problems we encountered during our practices. One such problem was when we had nurses originally drawing dosages for each individual. We found that the likelihood of a missed dosage was higher if the nurses were drawing them, as the nurses would be performing injections for many hours each day. And what happens to individuals that do the same task for many hours at a time is a lack of focus develops. To combat this problem, we ended up having the pharmacist draw the dosages early to allow the nurses to be able to just inject the vaccines, which in turn allowed more focus on the patients coming in. The mass vaccination revisions and implementation resulted in no waste of the vaccines in the employee and resident pushes, which is generally unheard of. Lastly, I'd like to touch on our Advent Health Foundation. The foundation is funded by donations from individuals and was created to research new treatments for diseases as well as help patients, whether it's with finances, mental health, or emotional health. The foundation works to help the communities that we live in and try to give back. If you are interested in volunteering with the foundation to help others, we can have someone give you the contact information for the foundation. As a reminder, today we discussed what goodness is, how important goodness is, some of the goodness initiatives we have done here at Advent Health, and what our foundation does for the community. At this time, does anyone have any questions?